These cells wants to proliferate, crawl here to there, jump from one cell to another cell, move from here to there without any restrictions, without any knowledge of what might happen in the body if they proliferate uncontrollably, just because it did not mature into the adult cell or differentiated into an adult cell. The adult cell knows its place in the body, what is right, what is wrong, how much it can proliferate, how much it cannot proliferate, what is the limit, how to handle stress and everything. So it follows the system that is maintained in the body. But the child, the cancer cell or the undifferentiated cell, it does not know anything of that. It does not follow any rules. It does not care about the body. It just cares about its own proliferation. But it is not just this cell is not getting differentiated or matured into this cell, but sometimes what happens is the matured cell also can go back into the undifferentiated form, which is something pathologists call as reversal of the differentiation. And this thing is called anaplasia. Literally means to form backward or backward formation. So a mature cell is getting back to its primitive form. So from matured, it is again getting back to its immature form. So it's just like the time travel, but in this case it is somehow with the genetics. So did we understand anything about anaplasia? It is the lack of differentiation. Cells appears primitive and atypical. So if there is lack of differentiation or lack of maturation, the immature cells tends to do whatever they want in the body and not care about the body or follow any rules that is made by the body. It can be extensive proliferation, it can be invasion into other tissues, it can be going in some other places through the blood, it can be formation of new blood vessels towards itself, maybe inflammation. Anything can happen just because they did not differentiate, they are not mature enough like an adult. Next, let's understand about the term pleomorphism. So as I said, if there is no maturation of the cell into an adult differentiated form, if it remains undifferentiated, then it retains or gains the power of extensive proliferation, just like this. So 1 becomes 2, 2 becomes 4, 4 becomes 8, and so on. So this one immature undifferentiated cell has given rise to multiple similar immature undifferentiated cells, which our body does not want. So these are extra unnecessary proliferation of which kind of cells? Of abnormal cells. Why they are abnormal? Because they could not differentiate into mature forms, and if they do not get matured into the adult forms, they will not grow old and they won't die. And if the cells are not able to die, they will just multiply and use the resources of the body and does not do any productive work to sustain the life as a system for the body. So these little pieces of shit is not maturing, is not dying, but rather consuming all the nutrients from the body, occupying unnecessary space, and does not even participate in any biological function which helps in sustaining the life of that person who has cancer, but rather killing the person. So they might look cute, but they aren't. So this is what it means, the term anaplasia, where the cell is not able to differentiate into mature form, maybe because of some mutation, or a mature cell is getting converted back into primitive form, maybe again some kind of mutation. They are regaining the property of dividing enormously. So we are done with the anaplasia.